Good morning, Assalamu alaikum, and Vanakkam to all of you. It's my pleasure to welcome you all, the participants, today for this great program. This is the second conference which is organized by Aika about foreign job opportunities for Ayurveda, Unani, Siddha doctors. Hope today's program will be a good session for all of us. Before entering into today's session, I would like to give a small introduction about our guest speaker. And I warmly welcome Dr. Raghupati Anandakrishna, Bachelor in Unani Medicine and Surgery, University of Colombo, Fellowship in Orthopedic Rehabilitation, Apollo Hospitals, Madawaski, India, Certified Professional Medical Coder, worked as a medical officer at Dubai Unani Hospital and working as a professional medical coder at Aster Hospitals, Dubai.
Hello, good morning, everyone. Hello, good morning, doctor. Can you hear me?
Yes.
Okay. Could you allow me to share my screen from your side? Hello. Are you hearing? Could you able to hear?
Yes.
Yes, sir. You can, sir.
So can we start the meeting, sir?
Hello. Hello.
Yes, sir, you can continue.
Yeah. Okay. So did you hear what I spoke just few minutes back, or just now we are hearing?
Okay. The introduction part was not audible to all of you.
Shall I repeat again?
Yes,
Yes.
sir.
Yes.
You have to repeat again. We didn't hear anything.
Yes, we didn't hear anything.
Okay. Can you hear now?
Yes, now
Yes.
we can hear.
Now we
Okay.
can.
Okay. Sure. Okay. So here in UAE, we can practice Ayurveda or Unani or siddha medicine after registering with a body known as Dubai Health Authority. So here we should upload our documents and get registered for the exam. So this is the only procedure we have to follow. So there are medical centers, good medical centers. We can work there as Ayurvedic medical practitioners or Unani practitioners. So they are paying starting from 7,000 dirhams. So now we can calculate the amount around 7 lakhs Sri Lankan rupees. And you can start your own practice also after getting a license from Dubai Health Authority. So we have in UAE 3 professional bodies to conduct these exams: Dubai Health Authority, Ministry of Health, and Abu Dhabi Ministry of Health. So mostly most people come and do Dubai Health Authority exams, so that it's easy and easy to pass, and no need to learn Arabic language. You can start your exam in English only. So if you can see my screen, can we practice Ayurveda in UAE? Yes, of course, you can practice. But the issue is you should finish 2 years working experience in home country. After finishing graduation and internship, you should have finished 2 years. Then only they allow us to do exam here. So here they call TCAM exam for all alternative medicine practitioners. And this is recognized here. Most of Indian doctors come and practice here, less from other countries. I heard one of our Sri Lankan doctor also worked here and left, and I don't know how many Sri Lankan doctors still practicing here. No contacts with them. So we need these documents to get registered with this Dubai Health Authority. So before come here or plan to come here and practice Ayurveda, we need this documentation. It should be attested by our registrar, University of Colombo, and it should be authorized, verified by Foreign Ministry of Sri Lanka, Consular Division. So all these documents we should attest. If you could see this my screen, you can see this registration, our license in Sri Lanka, internship certificate, experience certificate also. We should submit for 2 years period, and mark sheet, transcript. And we need another certificate, first aid certificate, that we have done first aid course in Sri Lanka. So that is also mandatory. They're expecting for medical practitioners. Otherwise, you can get the certificate in Dubai after coming here. That is expensive. Better you can do that exam or any certification. If you have, it should be attested by Foreign Consular Division, Sri Lanka. So these are the things. Another thing, good standing certificate. Also, we should get this certificate from Ayurveda Medical Council. So that is a little bit costly. Maybe they're asking 10 to 20,000. I hope from Ayurveda Medical Council. But Sri Lanka Medical Council, they are giving for 1,500 rupees. Now I don't know the exact amount. When I was in Sri Lanka, I went to ask a medical good standing certificate from SLMC, Sri Lanka Medical Council. So they are charging less amount. So this thing we can negotiate with our Ayurveda Medical Council, and with less cost we can get it done. So these are the important documents. We should make it ready before applying. So there is a portal in Dubai Health Authority. We can submit these documents. Other than those documents, we need a curriculum, CV, and personal declaration form, passport copy, and transcript also, that we should take it from our university. So this is the data flow. Here, the way of getting registered with the Dubai Health Authority. So we need to upload these documents, open one account in that website. I will share with you all the required Dubai Health Authority website, or it is here. You can see this screen. I will share these slides also with you all. So you can get registered yourself and upload these documents. This is the thing you have to follow. After uploading, they will verify. They will say that this is accepted. Then after that, we need to do the payment. After payment, it is validated, and they will send date. They will give a date for exam and instructions for the exam also. So that exam you can come and do in UAE, or in India also. They are conducting exams. So you can go to India and do the exams. After passing the exam, they will give a eligibility letter. With the letter only, you can come and practice Ayurveda or Unani or any alternative medicine. Here, this cupping therapy also there. We can do here this exam and practice cupping clinics are there. You can practice. So this is a procedure. And another thing, there are agents here. We can submit this document to them. They will upload all documents and verify these documents and ask us to pay the money for the examination. So they are taking some kind of commission and they will do all the paperwork on behalf of us. So that is another easy way to get registered with this Dubai Health Authority. So there are websites you can see: LinkedIn, Dubai, Indeed in Dubai. So where you can find job opportunities in Ayurveda or Unani, especially LinkedIn. Mostly better you can create one account and upload your profile and your experience and all, so that it's easy to identify job opportunities. So you can come on visit visa to Dubai. That is also one option. Come on visit visa and do the exam here. So this other job opportunities here. So you can see this screen: medical transcriptionist and ECG technician, OT technician, and medical insurance coordinator. And you can, if you have a pharmacy degree, you can do pharmacy or become a pharmacist also. For that, you need pharmacy degree or diploma. For that, they are not accepting external pharmacy certification. With that, we can't do exam here. At least diploma in pharmacy is required to become a pharmacist here. You can practice as a pharmacist technician with a diploma certificate and become a pharmacist with degree, B.Pharm or M.Pharm. For nursing people, there are good opportunity. Can get lots of opportunities here, more vacancies for nursing with BSc nursing and 2 years experience. That is mandatory. 2 years experience in our country is mandatory. So there's another option that is not mentioned here. That is medical coding. So in that field also we can join. That is another category of other opportunities we can join. So I will explain a little bit about medical coding. Hello, can you, hello? Hello?
We can hear.
Hello, can you hear? Yes?
Yes.
Okay. Another field of opportunity is medical coding. That is here in Gulf countries and Western countries. Medical health insurance is here. So all people are having insurance facilities. With this insurance card only, people going to hospitals to take treatment. Insurance companies pay the amount to hospitals. So here, between the healthcare provider and patient, we are standing there. Medical coding sector is coming in between these two. So in hospital setup, there are medical coders. What they do, they take doctors' documentation and converting them into alphanumeric codes. So medical coding is transformation of healthcare diagnosis, procedure, and medical services and other equipments into universal medical alphanumeric codes. So after converting into these codes, we are submitting these documents to insurance companies. So they observe these medical codes and all to pay the money to health care provider, to hospitals or doctors. So for example, you can see 40-year male complaining of loin pain, KUB done, USSS done, and after that they diagnose the patient having renal stone. So surgery procedure, cystoscope with ESWL. So what they do, extracorporeal shockwave therapy will be given to destroy that renal stone, and they insert DJ stent to make the urine flow smooth. This is the procedure done, and the documents you can see in the EMR, electronic medical records. You can see that, and we should put these codes, diagnosis code, for example, N20.0, that is for renal stone. So this is known as International Classification of Disease, that is actually created by World Health Organization. It is universal. Everywhere the same code is accepted. And the procedure for this cystoscope, we are giving a code 52332. This is known as current procedure terminology. So this code, they are categorized in a book called CPT. So there is a professional body in America, AAPC, Association of American Medical Coding. So what they are doing, they classify these all procedures and diagnosis and make alphanumeric codes like this. So this is the work we have to do if you become a medical coder here. So here you can see medical coders in their days. Hello, can you hear me?
Yes, you can
Yes.
take the presentation. Can you
Yes,
share?
please. Hello, yes. Can you see?
No,
Hello?
first presentation you can see.
The presentation, can you see?
No, no, we can't see the presentation.
One moment. Can you see now?
Yes, so we can see now.
Okay, fine. Okay. So I was talking about medical coding, another field you can practice, you can work as a medical coder. If you can't become, if you don't have enough experience, less than 2 years or in Sri Lanka, so they will not allow us to practice medicine here. It's mandatory. So if you are coming with 1 year experience or less than that, so you can become a medical coder or medical transcriptionist, any other field that you have studied in Sri Lanka, so you can practice. For this medical coding, you need 6 months of course period. You can learn this medical coding and become a medical coder. So for this, there is a body known as American Medical Coders Association, that is in USA only. They are conducting exams in Dubai and India, Philippines, in limited countries. So we can do that exam. After passing this exam, you can start a career as a medical coder. So I'm just explaining what is medical coding here. So here we are converting doctors' diagnosis and procedures into alphanumeric codes. So here UAE, as I said, all medical health services are under insurance, no free services. So with this medical insurance card, we can go to hospitals and pay our bills using this insurance card. So this slide I shared you, but you couldn't see. You can read this one. I will give this all slides to doctor, so she will share these documents to you all. So for this medical coders, there are places where we can work: hospitals, physician clinics, and labs, physical therapy centers, ambulatory surgery centers, daycare centers. There are vacancies for medical coders and medical transcriptionists. Medical transcription is another field that is you will work with doctor and radiologist. So doctor's documentation is going to say verbally. We have to type in and save in electronic medical records. So for that also we need medical knowledge, anatomy, physiology, and basic medical knowledge. Using that, we are going to convert that into medical records. So verbal recognition. What doctor say, you have to listen and carefully type the document. You would have seen medical reports in Sri Lanka, how the reports are organized and typed or printed. So this is another field, paramedical field that we can work with. Yeah. So in this course, we need to know this anatomy, physiology, and ICD medical coding and CPT coding. So there are institutes in India. You can easily join with them and study. This costs around $500, I think, $390 for this 6-month course. So after finishing that course, you need to go for one exam that is also conducted in India or UAE. Either you can come here or go to India, Chennai, or somewhere, Bangalore, do the exam there. After passing, they are giving one certificate that is known as CPC, Certified Professional Coders. So this is short-term course. You can study yourself and get good training for the exam. So this is the book they are giving for this medical coding exams. This is known as ICD-10, and another book known as CPT, Current Procedure Terminology, and another book is called HITFIX. This is regarding medical devices and other products, medical equipments. So these 3 books are mandatory to study this medical coding course. So these books you can get it from these institutes in India or UAE. There are institutes. They will send by courier, or they are sending these soft copies. You can practice. You can get photocopies or Xerox in Sri Lanka. If you are going to really start this course, I could able to send these books, soft copies to you free of charge. You can download and take printouts to start the course. But for the exam, you need original books. You have to take the original books to the exam center. That is, this is actually open book test. They are giving all books to you, and with the help of this books, you have to do the exam, open book test. So regarding this medical coding, if you have any more doubts, can ask. Doctor, over to you. You can ask any questions. I could able to answer. Hello. Hello.
So we can hear you.
Yeah. Can you hear me? Yeah. Please ask any doubts or type your doubts so that I could be able to answer.
Hello.
Yes, I
Hello.
can hear you.
Doctor, do we need to sit for the exam for working as a medical coder also? Is that necessary?
Yeah, there's an exam that is international exam conducted by American Association of Medical Coders. So that is conducted by American body that is internationally recognized. For that, you need to study this course, do the exam, then come to UAE to start your career.
Sir, is that held on UAE or India, or is that available in Sri Lanka?
No, they are not coming to Sri Lanka. It is available in India. You can go to India and sit the exam because that is cheaper than coming to UAE. That's what I'm saying. With basic medical degree, it's necessary. They're asking basic medical degree. With that degree only, you can do that exam. As you have a degree, there's no issues. You can sit for that exam. It's mandatory. You need that exam.
We need that, no? And doctor, you asked for the 2-year working experience for the Ayurvedic physician.
Yes, of course. Yes.
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 Does it prove by recognized medical institution, or can't we do in our private practice as a working experience?
Yes, that also you can submit, but you need to get verified from foreign ministry, Sri Lanka. There's a counter in foreign ministry, right? So you need to get signature from them, authorized. It should be authorized.
Authorized, no. Okay, thank you, doctor. Thank you.
Yes, of course. Hello. Hello.
Excuse me, sir.
Yes.
How can I register for the course, that CPC course?
Yeah, for that there are some institutes. I will send the links to doctor and you all. You can contact them. They will help you for the registration and all further. You can do the course online from your home place. Study online courses are available, and get the books to you and start studying those courses.
Okay, thank you very much. Thank you.
Yeah. Hello. Is there any questions?
Hello, doctor.
Yes.
Doctor, you answered my question as that we can do the coding, medical coding course via online. So, is there any website that we have to follow and go through? Can you please share the link?
Yes. I will share that link. I will send to this doctor, our doctor, and she will send this website to you.
Okay, doctor. Thank you very much.
If you can also type in Google aapc.com, AAPC,
Okay, doctor.
American Association of Medical
A-
Coders, AAPC. I will share my number also, mobile number. You can contact me anytime. Hello. Hello.
Sir, there are so many questions in the chat box also. Can you?
Yeah, I will answer to all those questions. How is the salary of medical coders? That is starting from 4,000 dirhams upwards. Salary is 4,000 dirhams upwards.
There is a question about DHA. Please explain about the DHA exam to get medical license.
Yes. So here, that DHA Dubai Health Authority, there are 3 bodies in the UAE, DHA and MOH and Abu Dhabi Health Ministry exam. DHA exam, we can easily do that exam, but we need to upload this certificate. Open one account to entering the website, upload your documents. So I'm sending this document. What are the documents required? From your degree certificate, medical council registration, and good standing certificate, experience certificate, 2 years experience certificate. All these documents we should upload and get registered. They will ask us to pay a little amount of money for the exam registration and further. After paying that, they will give one date, examination date. For that, we need to come either to UAE or India, Chennai or Kerala, Bangalore, any location you can select. Go there and do the exam. Once you pass the exam, they will give one eligibility letter. With that letter, you can come and start your career in UAE. Got it? Hello? Hello?
Yes, sir.
Yes, please.
Hello.
Yes, I can hear you.
Yeah. Hello, sir. If we don't have a first aid certificate, can we get it after we get into the UAE?
That also.
At the moment.
Yeah, from Sri Lanka, if you can able to get that first aid certificate from Sri Lanka, it is cheaper. If you come and do that course, and you have to sit for 1 day course, and then only you will be able to get that certificate in UAE. It's expensive.
It's expensive.
If you can get it done from Sri Lanka, any private hospitals, and get one certificate, that's better.
Okay, thank you, sir. From a private sector also, it's okay.
Yeah, acceptable.
Right.
Then all documents you should verify from our foreign ministry before coming or uploading these documents.
Okay, thank you, sir.
Yeah.
Hello, doctor.
Yes.
Good morning. I'm Dr. Hansani. Actually, 4 years experience in government sector. Doctor, I'd like to migrate UAE. So, what are the procedure I have to follow? Should I get some working license or
if you are having a license, Sri Lankan license with Sri Lanka Ayurveda Council, that certificate is enough. Yeah, that certificate is enough. You can get another certificate, that is good standing certificate. That is also from our Ayurveda Medical Council.
Oh, really?
And that is very important.
Should I get some offer letters or something?
No offer letters. After finishing your exams only, you can get offer letters. Offer letters will be given by companies or hospitals. After they hire you, they select you only, they will get offer letters.
Alright.
So first we need a license from Dubai Health Authority.
Before I migrate to UAE, I should get that license.
Exactly. You can come on visit and do the exam and get that license. That is one option. Second option, you can go to India and do the same exam there and come back to UAE. If it is expensive, if you feel that it's expensive to come and do the exam in UAE, you can go to India and do the same exam there. Got it?
Okay, sir. Thank you.
Yeah.
Okay.
Any questions more? Good morning. Yes.
Is there any syllabus for the DH exam for Ayurvedic doctors?
Yes. After registering with this DHA, they are giving a syllabus book. So from that only, they are going to ask questions and all. They are giving a syllabus book. Yes.
Are they giving the name of the book, or they give the whole notes?
They just printed books available, books
Right,
and questions and everything with them.
Okay, sir. Okay, thank you.
Yes. Hello.
Sir, there are questions in the chat box also.
I couldn't type and send answers. Could you please read the questions? I can answer.
Okay, sir. Can we get our experience certificate from government institutions like Ayurvedic hospitals?
Of course, yes. They should give that certificate. Nowadays, they are helping to migrate. So it's easy to get certificate from Ayurveda Medical Council or our hospitals. Yes, you can get that certificate from your head of the department.
Sir, is it possible to start with medical coder and after 2 years, shall we register as a medical officer?
There is another issue. If you lose your practice gap, you can't practice again or become a doctor here. There's another issue. Now you are working as a doctor there and practicing. It is it's going on. So if you leave that 2 years gap, it's a big problem. After that, you can't register with any exam for any exam here in UAE. That's a very important thing. You should not leave that job and do some other jobs and come back to practice medicine. Got it? Hello, doctor. Hello.
Yes, sir. If anybody has some doubts, please ask and don't lose this opportunity.
Good morning, sir.
Good morning.
So I am an Indian medical officer.
Yes.
So, now after internship, I don't have any relevant working experience. Is it possible to move to UAE with?
Yeah, you can come, but can't practice medicine. That's another issue. That's the issue. You can select any other paramedical studies or paramedical jobs or anything. If you have studied anything, that's why I'm telling that you can study medical coding with 6-month period and do the exam and become medical coder and come to your Gulf countries and work in Gulf countries. But without post after internship, if you have 2 years experience, then only they are allowing us to do the exam. Got it?
Yes, sir. Thanks.
Yeah. Hello, doctor. Hello.
Hello, doctor.
Yes, I'm hearing, listening.
Doctor, can I know, if you don't mind, can I know again how I register for that DHA exam procedure from Sri Lanka? And my second question is there any hospitals or
when we talk or at where we can practice as a doctor.
There is a website, DHA website, Dubai Health Authority. I will send the link to our doctor. You can see, or if you type in Google Dubai Health Authority, you can see all the details. Once, what you have to do, you have to open one account online that you can do online and upload your documents. Then it will, the system will ask you to pay money through online. You have to pay the money after uploading this documentation. So once they verify these documents, they are going to verify with the foreign ministry. Then they will ask us to pay for the exam, and we can get the exam guideline books and exam papers and all documents after that only. You can do the exam either coming to UAE or to go India, Chennai or Kerala or Bangalore. You can go there and select your exam centers. After passing the examination, they will send eligibility letter online through email. So with the letter only, you have to come and find a job here in UAE. That is mandatory, that eligibility letter.
Thank you, doctor. Thank you. It's clear.
Yeah. Yes.
Doctor,
Hello?
there is another question.
Yes.
Can we do the DHA oral exam online?
No. For that, you need to come either here. You need to come here or go to India.
Another question is, can we follow Ayurveda undergraduate or postgraduate course in UAE universities? And do we have any scholarship system?
No, not at the moment. No. Hello. Hello, doctor. No, it's not available here.
Yes, sir. Is there any questions to ask?
You're welcome. You can ask any question. Doctor, please give my number to all of them. If anybody want to contact directly, I will help them or guide.
Okay, doctor. Okay. Thank you so much, doctor.
Okay. Yes. So we can wind up the program.
Yes, we can wind up the program, sir. There is no questions. I think they are not asking.
Yeah, you just share my number so that maybe they can contact me anytime through WhatsApp. If they want to call, ask them to call using bottom line. I will help them or guide them.
Okay, sir. Okay, sir. Thank you, sir.
Always welcome.
We'll share your number, sir. If they contact us, we'll share your number.
Sure.
Thank you so much, sir, for the great program. So all of you, so stay tuned with us. If you have any further doubts and do you want to clear some more things, you can directly visit our center in Rajagiriya and contact our course coordinator and foreign development unit coordinator. So then you can clear your doubts, and if you need sir's contact number, please contact us. We can share you the contact number. So stay tuned with Aika for more useful webinars like this. And in the end of this month also, we are arranging another program that was cancelled before. Thank you so much all the participants who are participated in this program. Thank you, sir. Thank you again.
Okay. Bye. Have a nice day.
Thank you, doctor, for your valuable time explaining. And
yeah, you're welcome. Always welcome.
Aika, thank you for your organization these sessions. It's valuable for us. Thank you so much.
Okay, bye.
Bye, sir.